course, Adam, you and me, we are exceptions, but most doctors are not healthy and not optimized. So my question to you was, why is this exactly? So how come most doctors are not interested even in optimization? Why do they have accepted it's just getting old, man?
Yeah, I don't know. I struggle with this one a lot. I think there's a lot of both sociological factors and economical factors at play. The easy one is just the cost of things, which I fully understand. I had this conversation with a patient the other day, which was asking if they could use insurance to do some optimization. I said, insurance companies just simply aren't in the business of doing this. And it makes sense that, it would be very expensive for insurance companies to pay for guys to run their labs whenever they wanted and try to make a good or healthy levels even healthier, And so that most doctors are basically regulated and kind of constricted in what they do by the insurance companies or the hospital or whatever they work at, unfortunately. So that's a really big one. And then there's other issues too. I mean, even in medical school, I've talked about there's no like health optimization 101. We have anatomy, we have pathology, we have pharmacology. So we learn what's healthy and then we learn when it's diseased and then we just learn how to get it back to baseline, but never to take healthy and propel it, to an optimized state. Again, it probably just boils down to there's not a lot of money or there's too much money in there. It's too expensive for companies to do, unfortunately. And that's why a lot of these companies are cash pay. And then there's also just a very weird push as far as in society these days to almost glorify being unhealthy in a way. There's this healthy at every size movement that is literally telling people they can be obese and healthy. And doctors these days are actually not even really allowed to comment on things like weight and trying to optimize people in that regard. A lot of doctors aren't even weighing their patients anymore in fear of being in trouble, basically. So I think it's just this large combination of everything that comes together, and it's just unfortunate.
Yeah, it's just incredible. But what blows my mind is that, a lot of doctors that I know, a lot of my colleagues, dermatologists, if I go to conferences and whatever, they're all obese themselves. It's not the women. The women are okay, but the men, they all have a belly like this, and it's incredible. It's impossible for me that they don't realize that it's unhealthy.
I know. I think also the hours we work are so long and the lifestyle is so stressful. I mean, doctors on average pay more and more to go to school. They get reimbursed less and less. We have to chart more and more. So the work demand is higher and higher. The reimbursements lower and lower. And so they kind of fall and spiral into these unhealthy lifestyles. And I think we've all kind of been there, like, residency, you're working 24-hour shifts. And then it just goes on after school too, just not set up to allow the doctor to be healthy. So there's so many different variables, but it's always funny when you meet, like a cardiologist who's smoking and has an obese BMI and you're just scratching your head like, what the heck? I mean, it would be like, me walking around in high heel shoes with bunions or something. I always had to make sure that I had really good shoes on and if you were promoting tanning and walking around with a big basal cell on your nose or something.
Exactly. If you wish to support the channel, consider becoming a channel member and check out the links in the description of all the things I'm associated with. My ebook on compounded testosterone cream, multiple workout programs, Mizumi skincare, online pharmacy NP labs, and a list of Amazon links to the supplements we recommend.